What is the best wound care to avoid infection in the wilderness? Imagine you're miles from help, and you get a cut or a scrape. Your first thought might be to ignore it, but proper wound care can mean the difference between healing and infection. When you're out in the wild, access to sterile supplies is limited, so knowing what works best is essential. The key is to act quickly and use what you have on hand. First, if there's bleeding, control it by applying direct pressure with a clean cloth or bandage. Keep pressure steady until the bleeding slows or stops. Once the bleeding is under control, the next step is to clean the wound thoroughly. Use clean, drinkable water. Water safe enough to drink is safe for cleaning. Aim to flush the wound with a strong stream of water from a syringe or similar device. Use at least half a liter or more to wash out dirt, gravel, or plant material. Avoid using alcohol, iodine, hydrogen peroxide, or soap directly inside the wound because they can damage tissue and slow healing. Instead, apply antiseptics around the edges to reduce bacteria. After irrigation, use sterilized tweezers, sterilized by flame or alcohol, to gently lift out any remaining debris or dead tissue. Be gentle and avoid scrubbing or digging, which can cause more tissue damage. Once the wound is clean, cover it with a sterile or clean dressing to keep it moist and protected from dirt and bacteria. Use gauze, clean cloth, or improvised materials if needed. Change the dressing regularly, at least once a day, or whenever it gets wet or dirty. Keeping the wound moist helps it heal faster. In the wilderness, antibiotics and vaccines like tetanus shots might not be immediately available, but if the wound is deep, heavily contaminated, or caused by an animal bite, seek medical help as soon as possible. For bites from wild animals or bats, cleaning with povidone or chlorine dioxide solutions can help lower the risk of rabies. Do not close contaminated wounds in the field. Leaving them open allows drainage and reduces infection risk. If the wound is clean and small, you might be able to close it with tissue adhesive or sutures if you have the skill and sterile tools. Keep a close on the wound for signs of infection, such as increasing redness, swelling, warmth, pus, or fever. If any of these occur, evacuate for professional medical care. To sum up, the best wilderness wound care involves controlling bleeding, thoroughly irrigating with clean water, removing debris carefully, protecting the wound with a moist dressing, avoiding closing contaminated wounds, and seeking help for severe cases. Following these steps can help prevent infection and promote healing when you're far from a hospital.